What is a stress fracture? To put it in simple words, stress fracture is an overuse injury. So what happens is the muscles gets fatigued and they are no longer to cope up with the stress. So they end up transferring the stress onto the bone and the bone ends up getting cracked. And this crack is a stress fracture. How is it caused? Usually there is a history of either an increase in the amount of activity or the intensity of activity. For example, a tennis player who has switched courts, for example from a soft court to a hard court, a runner who has increased his running distance, or a basketball player who has increased his training duration. And very commonly it does happen in soldiers who have increased their marching distance. Which bones does it occur in? They can occur in any bones of the lower limb, but most commonly they occur in the bones of the lower leg and the foot. What are the symptoms of a stress fracture? Probably the most classic symptom of a stress fracture is pain with activity and relief after rest. You may also have swelling of the region where the fracture is present. How do we diagnose it? After a thorough physical evaluation, your surgeon might request you to undergo a radiological investigation like an X-ray, or sometimes he might also request you to undergo a CT scan or an MRI to confirm the diagnosis. How do we treat it? Probably the most important thing in the treatment of a stress fracture is to rest. To rest from the activity which caused the fracture. It's very important to give adequate rest because quicker resumption of the activity might cause a bigger fracture which is more difficult to heal. Of course, you may be given some pain medication to help and reduce your pain. Probably prevention is better than cure in these fractures. How do we prevent it? Always set incremental goals. Use good training equipment like use a properly cushioned shoe. Cross-train. For example, substitute your running with a bit of cycling and take dietary supplements like calcium and vitamin D. And more importantly, if you have any of the symptoms, do see your orthopedic surgeon.